My name is Cosette Champion. This weekend, I took the Hippocratic Oath and became a physician, and next week I'll move to St. Louis to start my internal medicine residency at WashU. Admittedly, this is a weird time to be starting as a physician. To say that the timing of this is opportune feels wrong. There's no such thing as a good time for a global pandemic. However, this pandemic happened just as my classmates and I prepared to start our medical careers. It brought a lot of social distancing, and with that, time for self-reflection. And I really do see that as an opportunity. Having this time and space allowed me to reflect not only on what it means to be a physician, but also how this pandemic has and will impact that. Match day fell at the end of our first full week of shutdown in North Carolina, and it was a day full of mixed feelings. Match day is a huge accomplishment as a medical student, and while I felt proud and excited for the future, it also felt strange to celebrate, knowing that across the country and the world, hospital resources were being overwhelmed and healthcare workers were running out of PPE. This is a sobering time to be starting out as a doctor. Still, at first I felt proud. I felt justified in my choice of career path. In the face of the pandemic, healthcare workers are essential, noble, even seen as heroes, and that felt good. The pandemic amplified the sense of selfless service that drew so many of us to medicine in the first place. And I couldn't wait to get to residency and fight this thing. In fact, I even felt guilty that I wasn't already doing more. Here I was, a few months away from starting as a doctor, sitting at home doing nothing in the face of a formidable enemy. I took an extra research year at Duke, so many of my friends are current interns at their respective institutions. And honestly, I envied them their position of doing something. After my initial thoughts settled, and I took some time to reflect, a new sentiment crept in. I'm so glad that's not me. But for the extra year, I could be the one in some overwhelmed hospital, caring for COVID patients with inadequate protective gear, calling to tell loved ones that their family member was very sick but no, they could not come visit. Instead, my husband and I were safe and got to spend our days at home together, watching TV or going for walks in our neighborhood. The sentiment was overwhelmingly relief. Initially, I felt kind of ashamed at this reaction, but after talking with others, as well as reflecting with some emotional intelligence toward my own emotions, I realized I'm not alone in these reactions, not even close. The conflict between one's own safety and the duty to care for patients is something that healthcare workers have faced throughout history. Physicians I deeply admire expressed some of the same sentiments, and I realized this balance looks a little bit different for everyone, which is okay. That was a humbling realization. At the end of the day, I'm still so glad I chose medicine, and I still look forward to starting residency, even if there are days when I feel nervous. I still feel like caring for patients is a calling, and right now, I feel ready to answer that call. As I prepare to start internship, I know the pandemic will change the way we practice medicine. First, I know things will be weird. These are extenuating circumstances, and I recognize that the transition to internship may not be as smooth as it otherwise would be. I aspire to be flexible and patient, with myself and others. Everyone's doing the best they can with what they have. Second, I want to remember that as scary as this may be, it's an opportunity to learn about something as it's happening. As one of my mentors said to me on match day, HIV shaped the way my generation of physicians practice medicine, and global pandemics will be the defining challenge of yours. This pandemic will certainly present new opportunities for critical thinking and teamwork, both in patient care and at the health system level, and I hope we rise to meet those opportunities. And finally, this pandemic will absolutely shape the type of leader I aspire to be. Medicine is so cool in that there's leadership at every level, from a resident leading a team, to a dean leading a medical school, to a physician advising national leaders. Seeing examples of great leadership in crisis and recognizing what makes that leadership effective will absolutely help me in my own leadership development. And I know next year will bring plenty of opportunities to put those skills to the test. So in short, it's a weird time to be starting as a physician, but it's also an opportune one, and I'm looking forward to what's next.